HCC coding is a risk-based coding methodology. It's what payers are beginning to transition to. So instead of fee-for-service, where they're paying providers based on productivity, this allows them to pay based on outcomes. So if a provider wants to show how sick his patient population is, so that he's paid at a higher rate, then he's going to need to use the HCC coding methodology.
The higher the score, the more complex and sicker the patient. The higher the patient score, the worse the expected outcomes, and therefore the higher the expected cost of care.
It's going to become more important for providers to be able to show how sick their patient population is. So if they're leaving off the comorbidities and not, if they, for example, code a patient as with hypertension and that's all, even though that patient may have diabetes, they may be morbidly obese, their HCC score is going to be lower and they're going to look healthier than the doctor down the street who's actually doing the HCC coding. So it is going to affect reimbursement.
The timing is right now because it is a 12-month model, and the time to set the baseline is before you actually negotiate your relationships and your contracts with the payers. Right now, only 18% of the practices around the country are using HCC in a commercial payer standpoint, but that number is growing, and it's growing at a very rapid rate.
With White Plume's products, we can show that HCC score in real time. If the patient is in front of the clinical staff, they can see that code based on the current diagnosis codes that are represented.
So the unique combination that White Plume provides for practices from an HCC coding perspective is the ability to help both the clinical staff and the coding staff accurately document, code patient comorbidities for those risk-adjusted plans.